Hello, and it's another Friday here at Reactive. I am Julie Hirschberg coming at you live from our Torrance office, actually, of Reactive. And if you didn't know, Reactive is a neurologic physical therapy and wellness center with 2 locations in the Los Angeles area. And our mission is to help people with neurologic diagnoses recover their movement, their strength, their confidence, and doing this through brain-changing therapy and exercise. And we do this with one-on-one therapy, OT, PT, personal training, yoga therapy. We do group exercise, and we do a lot of education, which is today, with other healthcare professionals. And our topic today, which is graded exposure in physical therapy for both dystonia and CRPS, is something I'm particularly excited to talk to you about, because this is a follow-up from last week and a little preview of the weekend course that is coming up here at Reactive on October 12th and 13th. And I just last night, not many hours ago, to be honest, we did it later in the evening, got off a planning call with our physician collaborators. So we are collaborating with Alan Wu from UCLA and Laura Ettinger, who's also in the LA area. Alan Wu's a neurologist and a movement disorder specialist, and Laura Ettinger is a neurologist and pain management specialist. And boy, getting on a call with Brittany Kim, my colleague here at Reactive, who's an orthopedic specialist, and the 2 of them was really phenomenal. Got me very excited about our weekend course coming up. But what's so refreshing is just to be with really like-minded people who value a team approach, especially to some of these disorders that are less known, can be difficult to figure out what's going on and treat. And one thing that actually came up as we talked last night was this idea of graded exposure. And this is something that we'll be talking about in our weekend course with both CRPS and focal dystonia. We talked a little bit about it last week with vestibular as well. And it was interesting to actually hear from Dr. Ettinger last night about how difficult it can be to do exposure well and in a truly graded way, so that somebody's symptoms are not exacerbated because you pushed too far and then they have a setback. And this is why this concept is so important and why we're talking about it today. So today we're going to talk about what is graded exposure, what are some of the concepts that apply to both CRPS and dystonia, and give you a little preview of what's to come in our weekend course, where we'll get to dive deeper into this and practice it much more. So let's talk about the term graded exposure first. It actually comes from psychology, where they talk about somebody maybe with an anxiety or phobia and gradual exposure to those things that induce a lot of fear. And this has been adopted in the physical therapy world in a similar way, because certainly there can be things where pain and somebody not moving because of the fear of having that pain. Or in the case of dystonia, also involuntary movement and not having control over that. So what we talk about with graded exposure is gradual exposure to specific situations or environments or input to the body, in which the person has experienced maybe pain or abnormal movement, to get them restored to full function. The goal is positive neuroplasticity, so that somebody can resume their full activities. And it includes also some principles of graded motor imagery. And I won't, that's a whole lecture in and of itself. I won't talk too much about that, but those ideas come into play with the graded exposure. So what goes on with graded exposure? Essentially, you want to move from the least provocative all the way to the most provocative situations. And this might be when we say provocative of symptoms, maybe, so pain if it's CRPS, or the intensity of muscle cramping or involuntary movements if you have dystonia. And we're talking focal dystonia too. Some of these principles do apply to cervical dystonia. So what might be the least provocative? And this is where you might be surprised if you haven't done this yourself, if you have dystonia pain or haven't worked this way with a person with those things. It may be as simple as recognizing body parts. And I know that can seem kind of bizarre, but something like right and left discrimination. And there's a really cool app, it's called the Recognize app, that actually takes you through looking at pictures of hands, and is this a right hand or a left hand? Pictures of feet, pictures of necks, pictures of the trunk, pictures of knees. And you can actually test and then practice discrimination and recognizing the body part. And that often is the least provocative, and that's a starting point, and the starting point of our motor imagery as well. From there, we might actually go to imagining movement. And even this can be quite provocative. I've had several people with focal task-specific dystonia that when they imagine painting or writing or drumming, for example, their hand already starts to cramp. And then we have to take it back a notch. So right-left discrimination, imagining movement, then moving into things like mirror therapy. So looking at the unaffected side in the mirror, and then your brain actually perceives it as the affected side in the mirror. I know it kind of is hard to imagine that without seeing it, but that's the concept behind the mirror therapy. From there, we might be able to take the next step to doing the actual movement, but in an altered environment or context. So like upside down. Now you're not going to walk upside down, but you might drum upside down, for example. Then doing the movement in the actual target context, drumming in the recording studio, on the stage, something like that. So in our course, in our weekend course, this is a big part of how we progress somebody through their plan. And we'll actually practice these activities, because honestly, when you first do some of them, it can feel a little odd or uncomfortable, and surprisingly can cause really interesting responses that you have to attend to. So like mirror therapy in CRPS, like you want to look for skin changes, for example, and be really vigilant so that you're not progressing too fast and causing a setback. Which, by the way, setbacks, flare-ups, all of those things are bound to happen in both CRPS and focal dystonia. It's something we plan for, we educate on. One thing that we do know is as we go through the graded exposure, as we are vigilant for those signs so that we can back up as needed. So, you know, I mentioned the drummer, so I want to give you an example of this person I did work with. He was a drummer and got intense cramping in one hand as he held his drumsticks. As I mentioned, even the imagined movements caused that cramping. And so we started with things like the right-left discrimination for the hand. And then we actually had to take those imagined movements in a different position. So laying down, head tilted back a little bit, we could start imagining those movements without hand cramping. And that's where we started until we could do that in sitting, which was the desired position. Mirror therapy was phenomenal in this case. So drumming with a hand that didn't cramp, when he looked at it in the mirror, it looked like the involved hand. So we could start sending some of that imagery beyond mental imagery, but actual imagery of a hand not cramping while drumming. The next steps then would be to alter the environment. So sitting on different surfaces, a different drum set, different different drumsticks, for example, would all be ways we'd alter the environment and then move into the actual target context where he'd like to be. And that would be how we would progress somebody with focal dystonia in that graded exposure way. In a similar case, for somebody with CRPS who may have really severe CRPS in their limb, not walking and putting weight on it, but wants to run. So that's the target task. So we might start with walking with an assistive device, gradually increasing the weight bearing through that limb, walking more symmetrically without the assistive device until we get to running. And sometimes that might take a whole year to do. It might take a shorter time depending on the length that that person had the CRPS. But that's the idea, is that we can actually map out what that would look like and give some expectations. And, you know, again, using some of those pieces of the optimal theory, some enhanced expectation that this does occur and can happen with careful progression and graded exposure. And I think probably one of the most challenging things is that sometimes it's these teeny, tiny baby steps, and you go forward and you might have to take a step back and find an even smaller step, and that can be very challenging. And there's some differences too. Often with focal dystonia, the person has a hard time stopping the activity. Like if it's with walking, they need to walk. And sometimes that's out of the question to stop walking. And so when you have focal dystonia and you repeat that pattern, it's hard to change it. And that's a big difference between having CRPS and pain, where it's like the pain is keeping you for sure from doing those activities. But in both cases, that positive neuroplasticity can happen. It does happen. We have many successes in this, especially with this slow graded return. None of us are jumping back into the activity right away, because that's like almost a guarantee setback. So that is the overview, graded exposure for both focal dystonia and CRPS. This is definitely an area we are going to be diving much deeper into in our weekend course, including some of those really great education tools. I think it's really important to set the stage for what we're doing and how long it takes and the commitment it takes, etc. And we're going to be practicing these actually with each other in the course, and providing a lot of these tools. So this has been really fun. Brittany and I, and actually her student Jessica, have been brainstorming and working on the tools that we would use with people with CRPS and dystonia for this education. And since it's one of the biggest pieces, I did want to share something with you now, a freebie. So we have created a dystonia program handout that we share in many ways. We use in many ways. I'm just sharing it with you all so that you can use it as well. Some of the ways that I use it is, one, it helps describe some of the underlying issues with dystonia and the specific approach to therapy that's much different than traditional therapy. And I think sometimes that's hard to explain to a person. So we've kind of boiled it down, distilled it down to steps and discussion about neuroplasticity and the commitment to change. And it describes that step-by-step approach, which I think is really helpful when educating people. And then thirdly, it really helps educate physicians, neurologists who didn't know that physical therapists can take this approach and help people with dystonia. I know for me, the way I use it, because often my head is swirling with a lot of ideas, it helps me organize that and explain it in a more simple way. So our team has worked on this handout over many years, simplifying it, distilling it down in easy chunks to understand. So I want you to have it. Please grab it. It's on our education page. right now at reactivept.com/education. I'll post a link for it here in Facebook as well. But we'd love for you to have that and use it to help more people with dystonia. So thanks again for joining us. We have next week another in our series where we're connecting these disorders from kind of chronic pain to abnormal movement disorders, and we're going to talk about some of the similarities in the brain, in the pathophysiology. This is where I get super nerd out about, but it's very interesting, and so I think you'll like that a lot. Join us next Friday for that, and of course, join us for our weekend course. It's October 12th and 13th. It's here at Reactive Torrance. It's unlike any PT course probably that you've taken, in that we are constantly moving and doing things for one. I know as a PT, I need that in a course. It's very hands-on. We're bringing patient cases. We're actually, you're coming to it, you're bringing a patient case so we can all problem solve. We have PTs, OTs, neurologists, pain management specialists. I mean, we've got a great team coming, and we've got these great brain swag bags that we are making, and it includes a lot of the sensory tools for assessment and treatment that you just don't typically have in the clinic. So we're gonna have those as part of it, and we hope you'll see us and join us there. We have a few more spots. It actually stays pretty small, so we can have that interaction. So grab a spot soon, and we'll see you there. Have a great Friday. Thank you.